Welcome everyone to another episode of the Geriatric Support Network Expert Series. Today I'm honored to be joined by Dr. Jason Crandall, founder of Bingocize. Dr. Crandall is a professor, researcher, and entrepreneur who created Bingocize to make exercise and health education more engaging for older adults. Thank you so much for joining me today, Dr. Crandall. I'm looking forward to learning more about Bingocize and your work promoting healthy aging. So, to begin, how could you tell us a little about yourself and what inspired you to create Bingocize?
Yes, thank you for the opportunity to be here. I am a professor of exercise science at Western Kentucky University. And so, since my graduate school years, I've been very interested in exercise and its impact on the aging process and longevity. So, several years into my career, I was teaching a course called Exercise and Aging, and I assigned a group of students to a local older adult facility to design and implement an exercise program. The day came for the program to start, and no one showed up, and it was because they were all busy playing bingo. So at that point, the name Bingo Size came to me, and I began to conduct studies to look at the efficacy of the program. That was in 2011, and ever since then, that's been my focus is to continue receiving grant funding, designing studies to look at the impact of the program. So the program we found evidence that it improves lower body strength, gait, balance, upper body strength, flexibility. We've learned that it teaches them a lot of really important information like how to eat better, how to prevent falls in their homes, and other really interesting outcomes, particularly social engagement, which we know is a real problem for older adults, especially during and after COVID.
Yeah, I really like how Bingocize it kind of combines both exercise and other things like social engagement, eating healthy, and fall prevention.
Yeah. And I think that's one of the reasons that it has worked so well is that, most people know exercise is good for them, but they just don't want to do it because most exercise to them is seen as not very enjoyable. So you have to find something that they do enjoy and try to combine that with the exercise. And I think for older adults particularly, bingo is one of those activities. We're doing work now with other populations as well. So we're working with people with disabilities, children, really anyone who needs to move, which is everyone, and who needs to learn some really important health information. We're trying to design bingo size workshops that fit everyone.
Yeah. Have you guys also considered incorporating Bingocize into patients with Alzheimer's and dementia?
Yes, absolutely. We haven't designed any studies to do that at this point, but many of our facilities that have a bingo size license focus on that population. So we have a bingo size in memory care. We have it in adult daycare. In fact, I'm presenting next week at the National Adult Daycare Association's conference um, because a lot of folks with cognitive impairment, Alzheimer's, can use bingo size because it's a very simple program. Especially we have a workshop that's focused on range of motion, so it assumes people have cognitive impairment. It assumes they're non-ambulatory, so it's one that works really well for that pop.
Yeah. So, for someone who's never participated in Bingocize, could you tell us a short overview
Hmm.
what a typical section looks like and kind of how bingo and exercise and health education are incorporated together?
Yeah. So the idea is that as I mentioned earlier, it's really to hide the exercise and to make it kind of in the background and then focus on the fun. And so if you look at a bingo size session, it is just that. It combines the game of bingo. So there's roles that, of course, they're putting numbers and letters on their cards. And interspersed within that are the exercises, which I designed the session to be really built around the game. So when there's a more intense exercise, there'll be more roles. And then, of course, interspersed with those would be health and education questions. And so I think the difference between bingo size from a health education perspective versus some of the other evidence-based programs is that it's, we don't want a big long lecture. People don't want to sit there and listen to a long, drawn out description of a health condition or such. So we just really use just really short trivia questions. The participants respond with the answer they think is correct, and then the facilitator will tell them correct answer and give them a little bit more information about that particular question. Then we move on. Because the secret to the adherence and the retention is that it is a game. I don't promote it as a program. I promote it as a game. And when you do that, that really increases your retention and your adherence.
Yeah, I think that's a really good way of kind of formatting a section to be really tailored to that group. Um,
Hmm.
Falls are a major concern for older adults, and Bingo Size includes fall prevention workshops. How can
Hmm.
size and education incorporated into the program help older adults with fall prevention?
Well, the exercises themselves are really focused on fall prevention. So we do a lot of standing. So of course they're typically at tables with chairs, and so we'll do a lot of chair stands. We'll do some what we call cueing drills, where they have to move in different directions, based on the cues the facilitator is providing. We have a lot of stretching, a lot of mobility type exercises because we know those physical exercises and physical improvements and maintaining that physical ability can in of itself lessen fall risk. Then with the health education piece, we start talking about ways they can limit their fall risk at home and outside the home. So things like making sure there's sufficient lighting on steps, that you really be careful with throw rugs. We know throw rugs can be a real fall risk if they're not secured to the floor. Medication use. A lot of older adults are on, a lot of polypharmacy. So those medications can cause dizziness, and that could increase fall risk. So we remind them, hey, if you're having dizziness, then you might want to talk to your doctor if there's possibilities of maybe, reducing some of those meds. So that in of itself could decrease fall risk.
Yeah. Um, for senior living communities or organizations that want to encourage older adults to be more physically active, what have you found that helps make a wellness program something residents actually look forward to participating rather than something they feel they have to do?
Well, I think I mentioned fun. Fun is something that they enjoy, something that is group based. We definitely know that groups of older adults enjoy exercise more when they are together as opposed to being alone. That's definitely something that increases their adherence. I think so. The enjoyment, gamification, having young people around. I think one of the things that I do in one of my courses is I send students out to these facilities to run bingo size and other exercise programs, and so uh, just the youth being involved in the program will help the older adults to have more fun. And of course, when you have more fun, you're gonna come back. So that's really important.
Yeah. Something I also kind of learned from being in geriatric facilities is this population really likes to see people from the younger generation come and
Mhm.
interact with.
Yep, yep, for sure.
So, Bingo Size was an idea at one senior living community and has developed an evidence base expanded internationally in the United States. So, what have you learned from seeing the program implemented in so many different communities and settings?
Oh, well, I've learned a lot of lessons over the years, but I think one of the biggest things that I've learned is that there's such a need for a program like Bingo Size. As I said, many people know exercise is good for them, but they just have lots of reasons they don't do it. Time is probably one of the number one. For older adults, it's that they just don't even feel healthy and fit enough to even start. So I think with Bingocize, having a very simple program that's fun, that people can come to and just about anyone can do. The way that I designed it is you can be non-ambulatory and still participate, or you can be really, really fit and you can increase the intensity of the exercises that are involved in the program. And so I continue to develop different workshops because um, as time goes by, people come to me and say, "Hey, have you thought about a diabetes education workshop?" And I said, "Yeah, of course." And that's actually something we're working on right now with the University of Kentucky to design a diabetes education workshop because we know that's such a really big issue right now in the population. And that's not just in the United States, that's everywhere. And I think um, we keep hearing from people in other countries. In fact, we had a meeting with some folks in Hong Kong a couple of days ago who were looking for evidence-based programs. They're actually occupational therapists. And so the evidence-based piece to bingo sizes, I think, is one of the things that's really made it successful because people want to know that they're not just doing just a program to do a program. They're looking for something that has some research behind it, that is structured, that has some training for the facilitators, because we know fidelity for any evidence-based program is really, really critical. So, yeah, again, I've learned a lot of lessons over the years, but I think simplicity and fun and fidelity are going to be really, really important when it comes to exercise, especially for older adults.
Yeah, I agree with that. Um, Lastly, if someone wants to be involved or help out Bingocize, what should they do?
Well, you can go to our website, bingosize.com, and we have an inquiry form on there. So they can just fill that inquiry form out, or they could just send me an email and I'll be happy to respond personally. So my email is jason@bingocize.com, and that's BINGOCIZE.com. So I'd be happy to talk to them about how to get involved.
Yeah. Um, and thank you once again, Dr. Crandall, for taking the time to join this interview. Do you have anything else you would like to tell our audience?
No, I don't. I just appreciate the opportunity to be here.
Well, that wraps up this expert series episode. Please check out the Bingo Size website, which will be listed in the description of this video for more information about this wonderful program. Please also check out the Geriatric Support Network website for more expert series that are soon to come. Thank you all for listening.